Dr. Wolff, we are in the great state of Arizona, what most people call the capital for golf, tennis, and pickleball. We have pro athletes here, and we have our weekend warriors. You see and treat both.
I treat everything from the pro athlete to the weekend warrior, and everything from the golfers to the tennis players that are still left, to the pickleballers, to the runners, to the people who are just working out in the gym, or the people who are walking the dog and playing with the grandkids and just want to stay functional. And I treat everything from spine injuries like neck and back pain or radiculopathy, sciatica, to shoulder injuries, knees, hips, arthritis type stuff, to overuse like tennis elbow, golfer's elbow, tendonitis of shoulders, and a lot of spine injuries would be a big focus of this treatment as well.
These procedures won't take them out of the game for long, correct?
Correct, compared to surgery.
Yes.
So there's a role for surgery, but 85% of injuries, for the most part, can be treated non-surgically.
And it's Spine Awareness Month, and you guys got some innovation here. Something that I read, it's called Discseel. Is that correct?
That's correct.
What exactly is Discseel?
So Discseel is newer technology, and it's been a long evolution. Discseel is treating the actual problem. So you have a mechanical problem, a bad leaky disc, and now we have a mechanical solution sealing the disc using FDA-approved fibrin, which is like a glue with regenerative properties. And if you have a bad disc, I'm injecting the outer ring of the disc, the annulus, that has tears and is painful often, with this fibrin that seals it and then begins to heal it. And then oftentimes I put growth factors sometimes in the middle of the disc.
Dr. Wolff, there's a lot of buzz around these words, regenerative medicine. What does that mean and what do they do?
Well, let me do my best to try and explain it to you and anyone else that might be listening. Regenerative medicine, using, say, platelet-rich plasma, or PRP for short, is taking your own blood out, spinning it, and concentrating the platelets, now like 8 times, say, baseline when you started, and getting rid of red blood cells and inflammatory agents like white blood cells, and then injecting these growth factors, the platelets, back into the injured area. And what that does is actually stimulate repair naturally. I've been injecting people with PRP and other biologics for 10, 15 years now. And as things get advanced, I'm staying leading edge. For example, I have a 16-year-old tennis player in high school who was debilitated, and I treated her back, and she's now a collegiate tennis player, competitive. I have someone that's mature, like me, who's a marathon runner, and he couldn't run, and I've injected his knees, and he's running the Tokyo Marathon. I think he's in Germany this week or next week running. So it takes people that have problems that keep them from being functional, and I'm repairing them. I have another lady who is a horseback rider, like cutting, competitive, and she injured her foot, actually broke her foot, had surgery, and I injected her with Biologics, and she went on to win the world championship in her division a month later. It takes injuries and it helps heal them at a more accelerated, complete fashion so that people are functional again and get back to what they want to do and love.
Callie, why is this cool?
It's pretty amazing to see that we're taking something that our body already makes and then healing itself rather than putting, external medications or steroids like I know what Dr. Wolff had spoken about earlier, because in the long run, it's really what's best for our patients.
It is incredibly satisfying that I have more tools in my chest to treat people with besides just, here's a pill, go to therapy, and sorry, go to surgery. So now I have more tools and I can help restore health and long-term benefits so they can be active and functional again.
If you'd like to learn more information about what you just saw, go to the website or call the number you see on your screen.